Hi, this is Betty Long, founder and CEO of Guardian Nurses Healthcare Advocates. Welcome to Season 7 of the Lighting Your Way podcast, a season in which I continue to talk with my Guardian Nurses colleagues and hear from them about their day-to-day support of our patients and clients. Their stories are heart-wrenching, uplifting, empowering, frightening, captivating, and true. Welcome to Season 7. Last season, Season 6, we talked with my colleague Suzy Parker out in Seattle, who was working with a patient who had a jaw deformity from birth. And Suzy worked with her on the insurance issues. But in this episode, we catch up with Suzy again as she tells us and shares the story of a successful surgery. Suzy Parker, welcome back to the podcast. It is good to have you on as a second guest, or second visitor, I should say.
Thanks, Betty. It's great to be here.
Yeah, no worries now, no nervousness. You're a veteran of this. So, Suzy, you are, let me reintroduce you. You are our mobile care coordinator nurse out in the great state of Washington as the Northwest Sheet Metal Union, and that is based in Seattle, but there are also, I guess, members all over. Can you tell us a little bit about the union?
Yes, so it's Northwest Sheet Metal Workers, and I cover 4 locals, which are basically Washington, Idaho, Montana, and Alaska. But as you said, there are others that are, some of them are still working and they're on jobs, say, for example, in Phoenix. And then there's the retirees, which can be all over, but they're mostly in the warmer states.
Good move for the retirees, yes. Especially being in Alaska or even Seattle, Washington, where it can get kind of cloudy and rainy when in the winter. Yeah. So you, unlike some of our funds do have one nurse, and you shoulder that work by yourself. So you're dealing with all sorts of patient issues, both acute and also complex, where patients are dealing with chronic conditions. So, what does your day look like for the most part?
Well, every day is different, which I like. Some days are hospital visits or accompaniments, meaning accompanying patients to their doctor's appointments, sometimes home visits. And then there's a lot of phone calls because, a lot of them are not local enough.
Right. Obviously, you can't fly until we have the Guardian Nurses jet or helicopter. You could zip over to Montana. What I'm really interested in is that the Health and Welfare Fund utilizes you and your clinical experience a lot when they are reviewing cases. And in this instance that we're going to talk about, this is what happens. So how often do you get called into meetings where the trustees are talking about perhaps a case? Tell us about that. What's that process like?
Okay, well, so the Board of Trustees, of course, they meet quarterly. And then in the morning before everybody comes, there's the appeals meeting. And so I've been their, quote, clinical consultant for those cases. I have had about 5 or 6 now, I think, since I started back in February of 2022, where these certain patients that I am working with, I spearhead the appeal process for them. So I help with getting all of the medical records, make sure all of the T's are crossed and the I's are dotted before I send everything off to their third-party administrator, who will then review it and forward it on to the appeals committee. And then when it's a patient of mine, it's a legal proceeding, so their attorney runs it. Patients either call in or they come physically. It's their choice. And I'm not allowed to really say anything because it's my patient. They don't want, there's bias there, obviously. So that's during the testimony. I am not allowed to testify. However, I can, put in my 2 cents after the recording is off and the patient has left the room.
Okay. And in those 6 cases, if you can recall, what's your batting average? How are you? Are you 5 for 6, 4 for 6, 6 for 6?
I'm 6 for 6.
Hey, Suzy, you're batting 1,000. Holy smokes!
Well,
And when you and I were, we talk about these cases that you have when we touch base, and I was particularly struck by this case that you've recently been helping the patient with, and who's given us approval to talk about this case because it's so recent. But tee this up for us a little bit.
sure. So I met this young lady. She initially, I met her about a year ago. And so she called first of all, she was born with an underbite. So the lower jaw juts out, basically. And she's lived this way her whole life. She's in her mid-30s right now.
Okay.
So she had called the union, who said, call Suzy Parker. And she called me, told me her story. And I met about a week or two later, whenever her next maxillofacial surgeon follow-up appointment was. And I could see with my own eyes, saw her, her face, the x-rays. So jaw surgery there was a request put into the insurance company for a prior authorization to reset, her jaw. And
Okay.
by the way, she's been having orthodontia for a couple of years, 1 year by the time I met her last year. And it was denied because they said it was cosmetic, which is what she's been told her entire life. And her mother, she said, when she was about 8 or 9 years old, was when her mother first, went to their then insurance company and was told, nah, it's cosmetic. So
Wow.
she kind of grew up thinking, well, this is how it is.
Wow.
Yeah.
Wow. So, she's what, young in early 30s, I guess, right?
Mid-30s. Mm-hmm.
Yeah. So she's been living with this jaw that was out of alignment, essentially, for her entire life.
Her entire life.
How
So,
how did that impact her day to day?
well, a lot, several things. So, first of all, she only had 2 molars on the left, upper and lower, and 2 on the right that actually touched.
Wow.
So her ability to chew food was greatly impaired and impacted. So there were certain foods, a lot of certain foods she couldn't eat. And if she, she had to take extra care to chew the food up the way you and I don't even have to think about it, right?
Right.
But if she had poorly chewed her food and swallowed it, then she would have some gastric upset, some stomach pain and problems. She also, by the time I met her, had split 3 teeth, right? Straight down the middle.
Wow.
And there were some words that she had not difficulty saying, but they were pronounced a little differently. And it wasn't noticeable to me. However, she has he was 5 when I met him
She
too.
she has she has a what?
A 6-year-old. Yeah.
Oh, Okay.
And she had told me that he was starting to pronounce some of these words incorrectly because he was hearing her talk. So it was impacting him too.
Oh, yeah, well, and plus
The
her
other
nutrition had to be impacted. She can,
Right. And
she's,
the other
wow.
thing, Betty, that she's had going on forever is chronic headaches. This lady, um, she spent so much money seeing specialists, having tests done, trying different medications, chiropractor to alleviate the headaches. And the headaches are all because of this deformity she was born with.
Wow. Wow.
Yeah.
Did like when they look back in her, were there any other relatives that had this deformity?
Nobody.
Wow. So, geez.
No. Yeah.
Oh, man. All right. So she's been denied the surgery to correct it. And was it who was doing the surgery? What kind of surgeon?
He's
Was
a
it a dentist or
maxillofacial surgeon.
maxillofacial? Okay.
He's highly skilled and he's a wonderful human being. So,
The double threat. Um,
yeah. Yeah. In fact,
so,
he asked to testify on her behalf at her appeals. So that was done telephonically. He had his, staff clear his schedule, and
wow.
I made sure that her case was first with the appeals committee so that he knew exactly what time and, how long to clear his schedule for. So that was really special. I've never had a provider say, I want to testify for my patient.
Wow. Yeah, no kidding. I mean, clearly he felt strongly, as did you,
Yeah.
right? I mean, that was
Yeah.
when you
Mm-hmm.
meet her and realize what she's been through her whole life, it does make
Yes.
you want to help her. So, how long had she been evaluated by the maxillofacial surgeon? How long had this process been when she was seeing him and had it denied?
Well, so her orthodontist put her in touch with the maxillofacial surgeon, and those two providers have been working hand in hand, getting basically her teeth manipulated in the way that they wanted them to be for her to be ready for the jaw surgery.
Oh, right, for like closure, like right to fix
Yeah.
it, and then so that she
Yeah.
wouldn't have to have additional treatment after that.
Correct. So
Yeah.
she's going to need her braces on for another year. But now it's just a matter of moving the teeth into the correct position that they were supposed to be in the first place.
I love this story. It's striking to me on so many levels. First of all, that she had to deal with this for, most of her adult life and, her entire life. But that
Mm-hmm.
now, right, it's been repaired and now she faces a future that she's able to eat and chew without difficulty. She can talk. So how long was the surgery? Was she inpatient at all? Or was it outpatient?
She was overnight inpatient. Mm-hmm. And let's see. We were able, so her maxillofacial surgeon, initially he's out of network, which meant her and her husband are going to have to pay like 20%, right? And
wow.
What the surgeon, or no, what the third party administrator of the insurance agreed to do, because there's nobody at all in her area, Betty, that does this type of surgery.
Right.
So because of that, the third party administrator went ahead and said, okay, we're going to treat it as in network. So they only have to pay 10%, which is good.
Wow. Thank God. Thank God.
Yeah.
I mean,
Yeah.
really, the stars aligned, right? The surgeon testified, you got involved, right? It's wonderful. So she had the surgery.
Yeah, I was going to say that the paperwork, I got the x-rays and then her photos from the surgeon's office along with chart notes and stuff, and sent them on to the third-party administrator. And they were really happy because the lady that I deal with there regarding appeals, she thanked me for sending. They already had some, but the films that I sent were far, far clearer than what was faxed to them by the surgeon's office. So I'm glad I did that, because then it was crystal clear. There was
right.
Yeah.
Yeah, picture tells 1,000 words, right?
Yeah.
Yeah, and not the to the printing or the faxing of an image. At least the ones that you showed me, it's crystal clear on yours. So I can imagine that it was another compelling piece of the presentation.
Yeah.
So she has the surgery. She goes home. So tell us about where she's at now. Like you saw her in the inpatient.
Yeah. So she is about a month post-op now, as currently. I went with her last week. It would have been her second post-op visit, and I was taken aback. Her mother, by the way, flew in from California to take care of everybody while she was, incapacitated. And
that's great.
She's told me that both her mom and her husband have said, her mother especially says, "You look the way I think you were always supposed to look." I mean, it just tugs at my heartstrings,
Right.
So initially, pain was a really big issue, but she only needed her opiate pain meds for 4 days and then relied on Tylenol and ibuprofen. And of course, they don't wire your jaws shut anymore. I guess that's pretty old school, but she had these really thick bands on 2 teeth, upper and lower in the front, to keep her jaw immobilized, which now she rarely wears them now. But she literally, Betty, before the surgery, she had you couldn't really see her upper lip, and her nose was really pronounced. But now it's like she's got a new nose and she has a new upper lip, which she, I mean, her mouth is beautiful, but everything was so distorted before. So she looks fantastic. She's doing great. She doesn't have to see the oral surgeon until or the orthodontist is completely finished with her. And so her follow-up with the orthodontist is next week, and that's where the work now, he's just going to focus on realigning her teeth to fit her new jawline.
Wow. Suzy, did they like break the jaw, her jaw?
Yeah.
Like wow. Okay.
Yeah.
To realign it.
She has hardware in her jaw.
Wow.
Yeah.
Phew. Wow. What a remarkable, I mean, thank God, right, that they can do that. It's remarkable to repair her, not only, I guess, physically and emotionally too, because I mean, just to her mom's comment, you look the way you were always supposed to look. Like that's kind of cool, right? From a mother's mouth. Wow.
Oh yeah. Yeah.
How about her son? Has her son said anything, or?
He just tells her she looks beautiful. He initially, because he's so little, was, and she almost looked like a white Tamir had post-op because of the wrapping and the ice packs. And then she had this net from her neck going above her head. She almost looked like a white Hershey's Kiss to me. But the swelling's gone. She still has some numbness in her lower lip and her chin, which the surgeon did a nerve test this week, and she's got feeling. It's just going to come back slowly. It should be resolved in 4 months or less. So,
Wow. Have you asked her what she most looks forward to eating when she's back full
I
full
didn't
speed?
ask her that.
And what,
Right now, so as a result of her jaw being the way it was for so many years, some of her teeth have raised higher.
oh,
So those are going to have to be filed down a bit in the
okay.
final stages. So she she is eating regular food. It is easier for her to eat, but she still has a couple of molars that are touching too much, and it's
Oh,
because
oh.
they grew out from the gum line, upper and lower, more because they had to. Do you see what I mean?
Wow. Yeah. Right. Right. They had to make do. Right. Because
Yeah, yeah,
wow.
yeah.
It was a fascinating case, and I'm so grateful that you were able to participate in having it approved, by the Health and Welfare Fund. And right, what a great story all around.
I do want to say though quickly because I paraphrased. I talked to her yesterday and I paraphrased her, and she said, when she first got the denial from the insurance company, she thought, well, I'm just going to have to learn to live with it. And she said, the general public, meaning lay people, she says, we don't know any better. The system seems to be designed for us to just give up. And then she said, when I found you at Guardian Nurses, meaning she called the union office, she said, because right away I told her, this is not cosmetic. And she doubted me a lot at first. Like, are you sure? And I was like, absolutely, I'm 1,000% certain, And so she said, the whole experience has been really empowering for her because she just been told so many times throughout her life that this was cosmetic and nothing could be done. You're just going to have to live this way. And she just said she wishes more companies would hire guardian nurses, and she's just is really grateful that she had this service.
Well, I imagine she would be. I can't imagine being
Yeah.
told for 30 something years that it's cosmetic. I mean, I'm sorry that you have to live with it. That we won't pay for it, and for her and her husband to pay for it, it would have been, upwards close to $100,000,
It
probably.
would have been it would have been quite a bit of money.
Yeah, and that's what
Yeah,
you carry health insurance for. And I do have to agree with her at some point that the system is kind of set to deny things initially, and then you have to exhaust a supreme human effort to get things overturned. But thanks to
right.
you, and thanks to the willingness of the fund and the trustees to
Yeah,
listen to you, to make
yeah.
her whole again, because that's really what you want to do. Is it's not like she's getting a nose job, right? Like from a cosmetic standpoint, she's trying to
Right,
she's trying
right.
to
She's not
eat,
getting a nose job.
right?
And the
So
good thing too, Betty, I want to say is that her headaches are starting to diminish. So, I mean,
wow,
this lady lived in constant pain for most of her
wow,
life with these horrible, horrible headaches. And the only thing that worked for her was routinely seeing her chiropractor and getting, like adjustments in her upper, in her neck.
wow.
Seemed to help alleviate that. But she hasn't seen her chiropractor in a month and she's not clear. She won't be cleared medically to go back to her chiropractor for another till she's 4 months post-op,
Mhm.
but she's already experiencing a decrease in her headaches. So that's, to me,
Oh,
that's huge.
wow. Yes, yes, yes. That's what I mean. This case is. I'm so proud of you,
Mm,
for the right for taking it. I guess I'm so proud of you for believing and helping her, right? Because now she feels
mm,
empowered, and maybe
thank
10
you.
years, 15 years down the road, if there's something else that she needs, she'll be able to take it on herself. I don't know. I do feel like patients just need a little leg up sometimes, right? To believe in them and let.
Yes.
Yeah.
100%. 100%. Mm-hmm.
So with all the six out, is this your sixth case? Because this is a doozy.
It's 5 or 6.
Okay. So when you think back, like, what is the lesson? I think your patient shared what the lesson is, right, in terms of never giving up. But for you as the nurse, looking at helping patients fight a denial, what's the lesson in it for our listeners?
Well, the lesson is a couple of things. Is I work to make sure that I have all of the supporting documentation to move forward with the appeal. I've mentioned this with, I think in the first podcast I did with you, that, a lot of times something as simple as, well, the patient didn't do physical therapy for their, spine when surgery gets denied. Well, oftentimes there's it just takes a doctor's note, whether it's already in the chart or not, saying, oh, this patient didn't do physical therapy because it was going to cause too much pain, and or it could increase their injury, So it's finding, because the insurance company never tells you straight up, well, we're denying it because you have to comb through their it's like a whole nother language, and see what are they talking about, why did they deny it? Because unfortunately it's left up to the patient or their advocate to figure out, why was this denied? In this woman's case, it was easy. They said, oh no, it's cosmetic.
Right. And you just went from there. I think the normal average patient doesn't have, perhaps, a guardian nurses. We're not with every health and welfare fund in the country or with every company, but there are advocates available. You just have to be able to find them and find out what their pay structure is. But I always say, give it a shot, right? Because all they can do is say no, and they've already said no. So why not try?
Right. And oftentimes, Betty, it's a family member who will step forward, hopefully.
Great. Yeah. Suzy, I really do. I think this was a great case, and I'm so grateful to you for helping her, and I'm sure she is certainly grateful to you, and I look forward to the after photos.
Thank you, Betty. Thanks for having me.
Sure. Okay. Take care.
You too.
Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, YouTube, Spotify, and Stitcher. If you liked what you heard, tell a friend and leave us a review. You can learn all about Guardian Nurses Healthcare Advocates on our website, guardiannurses.com. So until next time, find some joy in your life, pet all the good doggies and kitties, and remember to tell your people that you love them. Take care.